This is a presentation on our research of the effects of childhood sexual abuse on the long-term relationships of male survivors by Maria Cooper Cox, Amy Doyle, Michael Hazeltine, and Katie McGinn Odom. Our research shows that childhood sexual abuse, which we will refer to throughout this presentation as CSA, significantly impacts the long-term relationships of its male survivors. First, a brief summary of the literature that we reviewed for this topic. While there is significant research available on childhood sexual abuse, it proved difficult to locate research as it specifically relates to male CSA. One possible reason for this is that male childhood sexual abuse often goes unreported due to a variety of social stigmas. When males don't report their CSA, they often develop feelings of guilt and shame because of these social stigmas. These feelings, when left untreated, result in varying negative behaviors. These resulting behavioral and emotional problems, not the act of abuse itself, are what negatively affect interpersonal relationships. Male victims of CSA often cope with these problems in unhealthy ways, such as excessive drinking, aggression, or self-harm. They're also less likely than female victims of CSA to seek professional help as a coping strategy. Christian survivors of MCSA are faced with unique challenges, especially when their abuse occurs within a faith community. Abuse in a Christian context almost always has a detrimental effect on the way survivors relate to God, and in some cases, practices like confession and even forgiveness can do more harm than good by shifting the blame onto the victim and minimizing the offense of the abuser. Among white and non-white cultures, intimate partner violence is 2 to 3 times more likely when one of the partners has experienced childhood sexual abuse. Cultural influences on gender roles, such as machismo or stoicism, place additional constraints on the victim's ability to internally process his experience or to seek outside help. Research shows that the CSA of male victims affects the quality of all future relationships, but specifically has a significant impact on future intimate relationships. Counseling for the female partner is suggested due to the fact that trauma and negative coping behaviors can be passed on through the relationship. Additionally, couples counseling is encouraged to address the effects of these negative behavior patterns on the marriage, as well as unify the couple towards healing.
Current research shows that male childhood sexual abuse is much more prevalent than was previously thought. The rate is somewhere between 16 and 36%. Even the most conservative data indicates that the rate may be as high as 1 out of every 6 boys, and some studies show the rate to be closer to 1 in 3. Men are less likely than women to disclose their abuse, so it's possible that actual figures are even higher than that. This is a huge number of men that will carry the effects of that abuse into their relationships. Both survivors and their families can benefit from research that sheds light on some of the struggles they are likely to face throughout adulthood, and particularly in their intimate relationships. Studying the impacts of CSA may lead to more effective therapies. Men who are survivors of CSA often find it difficult to cope with some of the stressors of long-term relationships. Better therapeutic techniques could help men to cultivate healthier long-term relationships, which could in themselves also have beneficial effects on survivors. As future clinicians, we will almost certainly sit with male clients who have been sexually abused and who are dealing with the aftermath of that abuse. CSA can have significant negative impacts not only on survivors but also on their partners. CSA can lead to difficulty being vulnerable, difficulty establishing trust, and difficulty being intimate. Coping mechanisms can include unhealthy behaviors such as alcohol abuse, self-harm, or isolation. All of these factors can be very hard to deal with as a partner of a survivor. The literature tends to focus on women since girls are more often victims of CSA. Because cases of sexual abuse of boys are less common, there's less research into how sexual abuse affects men in their intimate relationships.
Minority male survivors of CSA have similar challenges as white males in processing their CSA experience and having successful long-term relationships. A significant common denominator among all cultures is the likelihood for sexual intimate partner violence as adults. CSA victims have higher correlation of perpetrating violence in adult relationships than non-CSA victims. The partners should be aware that they are at risk for this potentiality. Minority cultures are not supportive of seeking mental health and can have a general mistrust or unease with a typical white therapist. There is limited availability of sex abuse trauma counselors of like culture. Even so, overcoming the cultural taboo of seeking help and having the financial resources to do so are the greater hurdles. Intimate partners are often left dealing with a childhood sex abuse survivor who has received no professional intervention for his healing process. The lack of professional intervention for these minority males may be a large contributor to some of the findings of the studies. Unemployment levels are much higher among CSA survivors than men who are not sexually abused. Most of those who do work have below standard of living income levels. Both of these factors would place tremendous stress on an intimate partner relationship. The lack of financial stability or security adds another relational challenge. Non-white cultures typically have specific roles for the male to portray, be it stoicism, machismo, or the cool, non-affected guy. Words like vulnerable or victim are not expected to be a part of their identity. Rarely do these men feel the freedom within their culture to acknowledge what happened to them, nor to admit that it has any effect on their adult life. The burden of the secret and means of coping with that secret often undermine the quality of intimate relationships.
Most of the research shows that male victims of CSA often seek individual therapy for problems of which they may not be aware stem from their childhood sexual abuse. The manner in which the abuse is disclosed usually determines the type of therapy in which the survivor continues. If CSA is disclosed during individual treatment, the same therapy continues. Once the survivor has continued with individual treatment, it's not uncommon for group therapy to be recommended. Research shows that group therapy in conjunction with individual therapy is a helpful treatment method. Sometimes the female partner of the male survivor seeks individual treatment for themselves. Research done by Anderson, Jacob, and McCarthy-Veach showed that many negative coping strategies of the male victims are paralleled by their female partners. These may lead the female partner to seek treatment on their own. Couples therapy alone is not a well-researched treatment plan for adult male victims of CSA. However, couples may seek treatment due to poor communication, a problem with their sexual relationship, or some other dysfunction affecting the couple. Future recommendations are, first, if CSA is disclosed in individual therapy and the survivor is in a long-term intimate relationship, some attention should be brought to the relationship itself. Education of the survivor and the female partner should take place as to the effects the CSA may be having on their current relationship, and a suggestion should be made of couples therapy in conjunction with individual therapy. Secondly, couple therapy should include addressing the sexual relationship. One study of the effects of male CSA on female partners showed that most of the female partners believed their male partner was incapable of emotionally connecting during sex. Furthermore, because of the higher rate of intimate partner violence in the relationships of male victims, sexual safety measures need to be addressed during couples therapy. Apart from suggesting couples therapy in conjunction with individual therapy for the victim, this problem is not researched enough to state which specific treatment methods work best. Research does prove, though, that the approach of involving the intimate partner allows the victim and their partner the opportunity to begin the work of healing the wounds of childhood sexual abuse together.
In conclusion, it is clear that male childhood sexual abuse has negative and lasting impacts on its survivors. Common themes that arose again and again in our research on adult survivors of MCSA were the feelings of guilt and shame. Due to the taboo nature of MCSA, these feelings are often suppressed and adult victims go untreated, which can result in a variety of negative emotional and behavioral issues. It is possible, however, for the adult MCSA victim to heal through therapy and to develop effective coping strategies. An important part of the therapeutic plan of the MCSA client includes individual therapy, which leads to couples therapy, incorporating his romantic partner. The data presented in our research is astounding. It seems unbelievable that as many as 36% of our male population has experienced some form of childhood sexual abuse, yet no one seems to talk about it. It is our opinion that more open communication regarding MCSA will result in more men feeling comfortable in disclosing their abuse. This disclosure will hopefully result in more victims of MCSA receiving treatment, which will lead to better relational quality for its survivors. While there is significant research available on the CSA of females, there is not much available on that of males, and there's even less available on the CSA of males in non-dominant populations. Research is also lacking on the ways in which MCSA affects the loved ones of its survivors, particularly their romantic partners. We recommend that more research be conducted in all of these areas from both secular and Christian perspectives.